recording. We just lymph disorders to go over really quick, and then we'll be done. Lymphedema we talked about in my first lecture a little bit. Okay. So lymphedema occurs when lymph vessels and nodes have been destroyed or removed, or are no longer able to keep up with the amount of edema that's collecting in the tissues. Okay. And so we talked a lot about this. For your exam, you need to know the interventions for mastectomy, post-mastectomy lymphadenopathy. Okay, I want you to know that. They are things like elevate the extremities, no sticks in that arm, no injections in that arm, things like that. Okay, but lymphadenopathy just basically means edema due to some sort of dysfunction in the lymph system. Okay, lympharingitis or lymphangitis and lymphadenitis are caused by streptococcal bacteria, and so you need to know that for your test. It's usually strep. Okay. Assessment finding will be like swollen lymph nodes, sore throat. Okay. It's inflammation of the lymph nodes, or the tonsils and adenoids. Okay. Medical management is antibiotics if it's a streptococcal organism. Okay. Nursing management and teaching, make sure you teach them, not to share toothbrushes or anything like that. Stay home for 24 hours after starting antibiotics. Infectious mono. So we already kind of touched on that about how it can cause, or not cause, but how having mono correlates with leukemia. Okay, so you need to know that. Also know how mono is transmitted. Okay, it's usually oral secretions like spit. Okay, droplets. Usually young adults and teenagers and children are infected with mono. That's your patient population. Assessment findings are usually a sore throat, and then maybe some sores in the mouth. Okay. Let's see. And it's caused by the Epstein-Barr virus. So antibiotics don't work for mono. Okay, it's viral. They're at risk for leukemia later in life. Okay. All right, and then Hodgkin's versus non-Hodgkin's lymphoma. So you need to know. So Hodgkin's versus non-Hodgkin's. This happens. You have an older population that suffers from Hodgkin's, and then a younger population that suffers from Hodgkin's. And you need to know which age groups are affected by which ones. Okay. So lymphoma is cancer of the lymphocytes, which is a type of white blood cell, okay, and lymph nodes. And the problem with lymphoma is that it can metastasize and move around the body so quickly because you have lymph vessels everywhere throughout your body. And so whenever you have a lymphoma cancer, how you stage cancers is typically by their movement, okay? And lymphoma moves fast because they're in vessels. They're not in an isolated organ, right? They're in lymph vessels that go all around the body, okay? So Hodgkin's lymphoma is going to affect your teenage population, okay? And then non-Hodgkin's is going to be more common in children. Hodgkin's can affect teens, young adults, and then people in their 50s and 60s. Non-Hodgkin's is more common in children. In Hodgkin's lymphoma, one way to differentiate these on a test is they will, what they'll do is they'll take a slide of cells and look at the lymph node, and they're looking for Reed-Sternberg cells. It's a particular type of cell named after the guy who discovered it that's in Hodgkin's lymphoma. It's called a Reed-Sternberg cell. And they only have these if they have Hodgkin's lymphoma. Okay? You're going to see in a large lymph node, usually like for your post-auricular, maybe submandibular, you're going to have large lymph nodes, maybe like anterior cervical lymph nodes right here. Okay, so it'll be fixed. It'll be non-tender. Fixed means it doesn't move. Okay, it'll be fixed. It'll be non-tender. You can't reduce it. It's solid, which means you can't push it in and reduce it. Okay, they'll have fever, night sweats, recent unexplained weight loss, fatigue, and frequent infections because it affects your ability to fight organisms in the lymph nodes, right? So how to tell if they have it is they'll have a bone marrow biopsy. Treatments are going to be chemo and radiation. Hodgkin's is a particular type of chemo called red devil chemo. It's particularly toxic. Let's see. And that cancer will spread all around the body. That's the main complication with Hodgkin's and non-Hodgkin's lymphoma. Of course, a CBC with DIF. You may be positive on a Coombs test if you have lymphoma. Okay. Risk factors. The monovirus, again, is another risk factor for this, so you need to know that. Viruses such as Epstein-Barr are associated with this. Also, Helicobacter pylori infection. Helicobacter pylori is one of the few organisms that can live in the strong stomach acid of the stomach. And it frequently infects alcoholics, right? Because they have all those ulcers in their stomach from trying to absorb that alcohol over years and years. And so that bacteria gets into that ulcer and infects it. But Helicobacter pylori is also a risk factor for having lymphoma. Okay? It can be genetic. If you have AIDS, you can get lymphoma. Usually it's in males. You want to monitor their nutritional status, weight, pain, fluid balance, and Dr. Massey will go over more of this in cancer. Okay? They typically do a lymph node biopsy. That's how you tell if they have this. All right, so that's kind of a very quick overview of the lymph disorders. But there's not that many of them, and there's not that much on your tests, and usually there's not that much on boards. Lymphadenopathy associated with like mastectomies is going to be your most common board topic out of these. What else do I want to tell you? They'll be able to identify who's at risk for what types of anemia, so like African American sickle cell, Mediterranean thalassemia, vegans, vegetarians, pregnant women, B12, and your folic acid deficiency, maybe even your iron deficiency. Let's see. I want you to know signs and symptoms of thrombocytopenia. So if I list a bunch of signs and symptoms, I need you to be able to identify the ones that are indicative of bleeding or low platelets. Okay. Function of the lymph system, control edema by transporting excess fluid from interstitial spaces into the circulatory system, and they also house some of our most powerful white blood cells, okay, our immune fighters. Let's see. Schilling's test is for pernicious anemia. You need to know that. Vegans are at most risk for a macrocytic anemia like B12 or folate. Okay. The signs and symptoms of all anemias, so dyspnea, tachycardia, pallor, you need to know those. Okay. You need to know when an absolute neutrophil count is 500 or below, and you need to be on existing precautions. Polycythemia vera, you know the treatment for that is blood removal. No interventions in patient teaching for somebody with sickle cell crisis, so like no high elevations, prevent yourself from getting sick, prevent yourself from getting cold, prevent yourself from getting dehydrated. Don't do anything that causes a lot of stress, especially when you're in crisis. Okay. Let's see. We do have a couple of pediatric questions on this test, but it's only because some of these anemias only present the pediatric population. Okay. So be prepared for that. You know, the patient teaching with giving iron. Okay. Let's see. Patient with iron deficiency anemia, no foods that have a lot of iron in them. Know the normal B12 and folate. Folate is 1.8 to 9 nanograms per milliliter of blood, and B12 is 200 to 900. That way you can tell which anemia we're talking about. Again, patient teaching on sickle cell, a lot of that. Vegans and vegetarians, they're most at risk for deficits in iron and vitamin B. You need to know how to identify Cooley's anemia in a case study if I give you some parameters. So 2/3 of your test, or 40 questions, are going to be on these 3 chapters that we've covered today. The other 20 questions come from oncology. Lymphedema post-mastectomy, know some interventions for that. Know what causes lymphangitis, which I talked about with streptococcal infection. If you have resources from previous semesters, they will not help you. This test has been rewritten. But your study guide is updated to reflect that. Okay. Do we have any questions?
No, ma'am.
The 16 of you that are left, I don't blame you. It's a long day. But I have clinical. I have to do my clinicals for my doctorate practice. So I try to plan, when I do lecture, I try to cram it all into one day so that I can have the other days open for my clinical. So that's why you had to hear from me so much today. But, all right, that's all I got for you guys.
Thanks.
I'll stick these recordings up when they process. It'll probably take a couple of hours for them to process. Thanks, Christy.